Pediatric growth and development is a predictable sequence of milestones, and the NCLEX will test your ability to apply this knowledge in clinical scenarios, not just recite facts from a textbook. For instance, you won't be asked, "At what age does an infant develop a pincer grasp?" Instead, you'll see a question like, "The nurse is providing a snack to a 10-month-old infant. Which choice is most appropriate?" The answer is likely small, soft finger foods like Cheerios, which directly tests your knowledge of the pincer grasp milestone and safe feeding practices. Let's break down the key stages. For infants, from birth to 1 year, the central task is developing trust versus mistrust. Exam questions often center on promoting trust. This means responding to cries promptly, encouraging parental presence, and maintaining routines. A common trap is selecting an answer that prioritizes hospital policy over the infant's developmental needs. Stranger anxiety, which peaks around 8 months, is a normal finding, not a sign of a problem. The NCLEX might present this as a parent being concerned their child is not social, and your role is to provide reassurance and education. As we move to toddlers, ages 1 to 3, the theme is autonomy versus shame and doubt. This is the me-do-it stage. Questions will focus on providing choices to foster autonomy while ensuring safety. A classic exam scenario involves a toddler refusing medication. The correct action is not to force them or get the parent to scold them, but to offer a structured choice, like, "Do you want to take your medicine from this superhero spoon or this princess cup?" This respects their developmental drive for independence. Safety is paramount for toddlers because their mobility far exceeds their judgment. Expect questions about poisoning prevention, car seat safety, and securing the home environment. Preschoolers from 3 to 6 years old are in the initiative versus guilt stage. They are characterized by magical thinking and a fear of bodily harm. An NCLEX question might describe a preschooler who believes their illness is a punishment for misbehaving. The therapeutic nursing response is to clarify that they are not at fault. Another exam trap relates to medical procedures. Because they fear bodily mutilation, even a small injection is terrifying. The best approach is to be honest, but brief. Use a doll for demonstration and apply a bandage afterward, as this restores their sense of bodily integrity. The school-age child, from 6 to 12 years, is focused on industry versus inferiority. They think logically and concretely and enjoy following rules. Exam questions for this group test your ability to provide clear, step-by-step explanations and involve them in their own care. For example, you might teach a school-age child with diabetes how to check their own blood sugar, promoting a sense of accomplishment or industry. A common mistake is to be overly abstract or withhold information, which can make them feel incompetent or anxious. Finally, adolescents from 12 to 18 grapple with identity versus role confusion. The NCLEX will heavily emphasize privacy, confidentiality, and body image. You must know the legal and ethical lines. For example, you would interview an adolescent about sensitive topics like substance use or sexual activity without their parents in the room. A trick question might involve a parent demanding to know if their teenager is sexually active. The correct response upholds the adolescent's right to confidentiality unless there is a clear danger to themselves or others. To remember the progression of social development and play, think about how children interact. Infants engage in solitary play. Toddlers engage in parallel play, meaning they play alongside others but not with them. Preschoolers move to associative play, where they might share toys but don't have a common goal. Finally, school-age children master cooperative play, working together towards a shared objective. Recognizing these play types is key to selecting age-appropriate activities in exam questions.